what your hormonal results are meaning. Then in this session, I'm going to answer all your questions. Remember, if you have questions about your fertility, kindly your questions, I'll be able to reply. So going straight to today's first question. The first question is coming in from one of our friends. She asked and said that what is meant by AMH? What is meant by the anti-Mullerian hormonal test? What is the meaning of AMH test? AMH specifically, it means that there's a hormone, okay? AMH is a hormone specifically, which is released by a woman's eggs, okay? On top of your eggs as a woman, there's going to be some special cells known as the granulosa cells. These cells produce this hormone known as AMH. It's a hormone that can give a picture in regards to your fertility. It is a hormone that can give a signal, or it is a hormone that can indicate how your fertility is. It is a hormone that can actually also show whether you are nearing menopause or whether there are changes that are taking place. Mweno live session lero ndikwogera ku AMH hormone, ndikwogera ku hormone gye bayise the AMH hormone. Obanga obadde olina ebibuuzo oli kwebuuza AMH kitegeeza ki? Mweno live session ndikuddamu kino ekibuuzo. AMH kiba kitegeeza anti-Mullerian hormone. Hormone eno eva mu bitundu ebyomukyala, oba hormone eno gye tuyise AMH eva ku magi ag'omukyala, era ye hormone eyambako okulaba nti eraga amagi ag'omukyala gamala oba tegamala. Ye hormone esobola okulaga oba omukyala asobola okufuna mangu olubuto oba nedda. It is a hormone that can actually show whether a woman has high chances of getting pregnant or not, the AMH hormone. The next question is about where is it produced from, okay? Mukwano gwaffe abuuziza n'agamba nti naye hormone eno gye bayise AMH evaawa. The AMH hormone specifically used by some special cells on a woman's eggs. These cells are known as the granulosa cells. These cells specifically produce the AMH hormone, which actually indicates how fertile a woman is. It also indicates whether a woman can easily get pregnant or not. The AMH hormone is produced by those special cells known as the granulosa cells. The next question is about the AMH test prices. The prices of this test, the AMH test, they actually do vary from country to country. You could realize that if you in your country, the test could actually be at a particular price, different from another country. So if you go to your hospital, a hospital near you, and then you talk with your doctor, they'll be able to guide you on the pricing of your AMH test. I'm called Gerard Massa, and I'm a fertility coach. I'm talking about the AMH test, the AMH hormone. If you have been asking yourself, what is meant by the AMH, anti-Mullerian hormone, you are asking yourself what is meant by this. This is a special hormone which is actually produced by a woman's eggs, and this hormone specifically, it gives a picture on how fertile a woman is. It also gives a picture on whether a woman can easily get pregnant or whether she needs support from a hospital. The next question is about AMH and menopause. AMH and menopause. If a woman has entered menopause, how far, how high or how low is her AMH going to be? Menopause specifically means that a woman's eggs no longer are growing. Menopause simply means that a woman is no longer seeing her periods. She's asking herself that if she is in menopause, how far or how is her AMH going to be? During menopause, that is maybe when a lady is around 50 years, and then she does the AMH test, because according to the standard readings, the AMH tends to decrease with age. So if a woman is in her menopause, then there's going to be a reduction in her AMH. Globally, the normal anti-Mullerian hormonal test results or the normal AMH hormonal test should be between 1 up to 4 Ng per deciliter. But if at all your results show that you are below 1, you are maybe in 0.3, 0.5, then it actually could indicate that there's something that is not right. So the results of AMH together in menopause, normally in menopause, AMH tends to reduce. And then the next question is about AMH and progesterone. She's asking that what is going to happen to AMH and progesterone. AMH and progesterone, what is going to happen when a woman has done the AMH test and then also she's asking herself the progesterone levels are also low. What is going to happen to her AMH readings? Normally, one thing you have to take from this live session is that progesterone hormone is a hormone that is responsible for making sure that when a woman gets pregnant, the implanted egg, the fertilized egg that has attached itself onto the wall of the uterus goes up to term. The fertilized egg grows up to term, okay? So progesterone simply provides a conducive environment for this particular egg to grow in the womb. If at all a woman has done the progesterone test and then she's asking herself why is it that her progesterone is low and AMH is also low. When progesterone is low, it simply means that the womb, the inside of the womb, we call this the endometrium, is actually not having enough progesterone. And in most cases, when progesterone is low, then we need to go back to another hormone known as the luteinizing hormone, LH hormone. Because one thing you have to know is that when LH is low, then it means that specifically progesterone is also going to be low. Okay, we have one of our friends. She's called Zuzu. One of our friends is called Zuzu. Zuzu, you are most welcome to today's live session. I'm called Gerard Massa and I'm a fertility coach. I can answer all your questions about fertility. So today's live session, I'm talking about the AMH hormone, anti-Mullerian hormone. And I was saying that when you do the AMH test and then the results show that your AMH is low and then your progesterone is also low, this simply means that there could be an issue that is actually happening. It means that a woman can actually get pregnant, but she needs support so that she can easily get pregnant. Why? Because if the AMH hormone is very low, maybe it is below 0.5 or it is 0.5, 0.2, and yet the normal is supposed to be 1 up to 4. And then the progesterone hormone is also low. It simply means that she can get pregnant, but even after getting pregnant, there's a big risk of this particular lady getting a miscarriage. When progesterone is low, then it means that there's a big risk of a woman actually getting a miscarriage. So if you have questions about the AMH hormone, you can kindly ask in the comments. I'll be able to reply. The next question is about AMH and prolactin. AMH and prolactin. She has done the hormonal test and the results are showing that her prolactin is actually high. She's saying that her prolactin is in 100, okay? And then her AMH is still low. She's asking herself, what could be the problem? Why is it that prolactin hormone is in 100, okay? And then her AMH is low. Prolactin is high, but AMH is low. Your results are showing that prolactin is in 100 and then AMH is below 1. Your AMH hormone is low. Why is this happening? Why is this so? I'm going to answer this question. So one thing we have to understand is that prolactin is a special hormone. Prolactin is a hormone that is responsible for many changes in a woman's body. Prolactin is a hormone that is produced in the brain of a woman. Specifically, it is produced from a small part known as the anterior pituitary gland. So when prolactin has been produced in a woman's body, it travels in the bloodstream and then of course it goes to the woman's breasts. It is a hormone that is responsible for breast milk production. Prolactin is responsible for breast milk production. The normal prolactin hormonal levels are supposed to be 0 up to 25. If your results are showing that your prolactin is higher than 25, like in this particular case, her prolactin is in 100, then this means that she's having high amounts of prolactin hormone, but at the same time, she's not pregnant. This is a condition that is known as hyperprolactinemia. Hyperprolactinemia. She's not pregnant, but her breast milk production is taking place. Her prolactin hormonal levels are high. Okay? Okay. Yeah, so she's not pregnant, but her prolactin hormonal levels are high. She's asking herself, why is this so? Why is it that her prolactin is actually high? And the answer is that there could be an issue that is happening in the brain. There could be an issue that is happening with this small part in the brain known as the pituitary gland. In most cases, when a woman gets issues in her brain, specifically this pituitary gland, when small growths begin growing, when a woman begins getting small growths in her brain, or even when a woman gets hormonal imbalances, these can actually be among the main reasons as to why a woman could end up with hyperprolactinemia. And then the other reason as to why a woman could be having high prolactin hormonal levels could actually be due to the fact that maybe it could be an issue with some changes that are taking place, like maybe the AMH hormone not really being within the normal ranges.